Hi, Demia.
Happy Friday.
Yay, it's Friday at the end of the day.
Yes, I was just thinking, like, wait a minute. Okay, so I already pre-populated the polls in here, Diane.
Awesome. Okay,
And
perfect.
so I'm just wondering, so when it's time to poll, let me see. I guess I just click polls then and it'll come up,
Yeah.
right? Okay.
Yeah.
Okay.
And so the first two are going to be right at the beginning. So
Yes,
I'll tell
yes.
you when, and then we'll go from there.
Okay, cool. So I'm so happy I finally got everyone's stuff, and so we should be good to go.
Yay. Sorry for, I feel like it's a lot. I feel bad. But
It's okay. I think it was just so much back to back yesterday.
I know. And usually we wouldn't have a learning collaborative like on today, a back-to-back from, but it just happened to be that way because of the holiday.
Yeah, that's fine. Totally understand. It's a lot. It is a lot of meetings, that's for sure.
Yeah. Will you post the agenda?
Yes.
Okay, perfect.
You want me to post it now, or do you want me to wait like 5 minutes before, or?
It doesn't matter. Whenever. You don't have to do it right now, but right at the beginning of it would be
Okay.
awesome. Yeah.
Hello, can you hear me?
Yes, we can.
Hi. I'm a little early. I'll put myself on mute.
No problem.
Let me see. I won't really need my camera on at all, but let me see. I have to get this set up where, okay, I'm looking directly in the camera now, but my monitor's on this side, so I have to go this way.
I know. I don't know how I'm gonna do it when I'm at the office because I guess we when we're at the office, I guess we can get one of those ones that we put like right up on the two monitors in between the two of them. Because that's what some of the other people have done.
I think I'm gonna start using that one again because I had one when I first started and I took it off because it kept falling. And it just wasn't working out right when I was set it on the top here. I'm gonna try it again. And I actually kind of like this camera better, but I'll try it.
I don't have one of the other ones, but I was like, I don't know how I'm gonna do this when I get back to the office because it's gonna be totally different.
And I should try it. Let me see. And then if I want to turn my camera off and on, I have to lean like this to see because my laptop is open because it's coming from my laptop. I have to lean this way. So yeah, this should be fun. I want to try it really quick.
Dania, can you make it a little bit smaller?
How's that, Diane?
Yeah.
Okay, great.
Good afternoon, everybody. Thank you for coming today. We're going to allow a few more minutes for everybody else to continue to log on. So if you could please put your name and your organization in the chat box, that would be helpful. Good afternoon, everybody. So I'm just gonna give it a couple more minutes so that we can see if we can get a few more people logged on, and then we'll get going. If you could just put your name and your organization in the chat box, that would be helpful. Okay. Looks like we have quite a good turnout. Thank you guys so much for coming to join us for the Friday afternoon. So today we're going to be talking about the MCO rosters. And let me see if I can turn my webcam on here in a second. Yeah, so we wanted to provide this so that everybody here could understand how to use your rosters. And so we're going to have each of the MCOs present for us. But first of all, we have a couple polls that we would like for you guys to start out with. So we're going to get started with that. So I'm Diane Halo, and I'm the program director here at Greater Columbia. And Sam is also on the phone. Sam, did you want to give a little preface before we do the poll?
Yes, welcome everyone. Excuse me, I'm just now getting some of my voice back. So thank you for coming to the MCO rosters. As you know, it's one of your milestones. That was mandatory in year 2 and year 3. So making sure that we understand how to obtain those, how to work those, what the expectations are from our managed care providers. So please be sure to ask all the questions you can to make sure that you're appropriately applying your processes in order to align with your MCOs. Thank you.
Perfect. So Damia, could you please put the first poll up? So we'll do the first poll. And so I'm going to have Damia help me with this since she helped with creation of them.
Okay, I'm going to go ahead and hit launch polling.
Perfect. Okay, so the first question is your organization using the MCO rosters? And this is good for us to know because we need to know if you guys are actually using them. The second question is your organization ensuring the accuracy of the MCO rosters? So I'll just give you a couple minutes to submit those. Damia, does it give you real-time results? I'm not sure. I've never used them, so I don't know.
I have it on the screen here. You can see the numbers fluctuating. And then when you're ready, I can end the polling.
Okay. We'll just give it one more minute.
Diane, you have a question in the chat here. Do you want
Yes, I just responded. So
okay, great.
If you're not a primary care provider, don't worry about answering the questions just because they the MCO rosters don't really pertain to anybody but the primary care providers, but yeah, so that way it doesn't kind of screw the numbers. Perfect. Okay, Demia, can you show those results? And we just see the agenda right now, just so you know. Okay, perfect. Awesome. So it looks like about 75% of you are using your MCO rosters. And it looks like about half of them, so it's about 50-50 split between organizations that are ensuring the accuracy of those MCO rosters. Sam, can you give us a little information as to why it's important to ensure the accuracy of the MCO rosters?
Yes, for those that are in value-based reimbursement or new payment reforms, is definitely to understand who your patient population is and that it is cross-applied, looking at your empanelment of your patients, and also identifying those patients that are not on your empanelment in your EMR systems, to reach out to those patients to be proactive and establish care if they need it. If they do have primary care that is elsewhere, to educate them that we need to update that with the MCOs, and also to open those lines of communication on those rosters and be able to inform your MCOs what patients really truly apply. If you have patients that refuse to establish care, but you continue to reach out to them. So just making sure that we're being a proactive approach to understanding who our patients are, and making sure that we're closing those gaps of care where those patients might not know that they need to reach out and establish that first initial visit.
Diane,
Great.
there was a question in the chat from Laurel. How many people actually responded? Do we have that information from the poll, Demia?
Demia would have those numbers. Demia, do you happen to
Let me
have that?
stop sharing. Let me stop sharing then. Hold on one second. See
Okay,
if it
hold
generates
on.
it. 43
And then-
people, Chelsea said in the chat.
How many?
43 people.
Oh, 43 responded, Laurel. Great. Thank you guys for participating in our polls. So
Sorry,
the next-
43%.
Oh, 43%.
Mhm.
Okay, of the people, so about half of the people that are on the call today. So we have about 42 people, so about around 20. All right, so the next thing that we're going to do is we're going to give the opportunity for the managed care organizations to present. So the first presenter we're going to have is from Molina, and it looks like their team is here, and I'll let them introduce themselves.
Yeah, hi guys, this is Kelly Graham. So I'm new on sharing Zoom screens. I have a lot of experience on Teams, so let me see if I can do this.
Did you want to share your screen, or did you want Demia just to go through the slide for you?
You know what? It would be great if you could do it.
Okay,
I
perfect.
have it right here. Okay.
Just tell her when you're ready to go to the next slide.
Okay, thank you. I did turn my camera on, but I can't tell if you guys can see me. Can you see
We
me?
can see you.
Oh, hi. I can't see myself. So hi guys, I'm Kelly Graham. I'm Director of Provider Engagement here in Molina, Washington. I'll be taking you through the slides in our presentation today, along with Carla Crooks, who is a Senior External Provider Services Rep here at Molina. So I'll do a couple intro slides, and then Carla will do a demo of how providers can get to their rosters. And then we'll go through a few slides that are targeted at answering the questions that I think this group has. So next slide, please. Thanks. So first, just a little about Molina, Washington, in case you don't know it. So Molina is a national organization, been serving Washington for 20 plus years. We are the largest Medicaid and Marketplace membership plan in the state, with over 1 million members, which, we always have to kind of pinch ourselves. We've been growing a lot over the past years, and so we're really excited about that. We do serve Medicaid members in every Washington county. So we are statewide in Washington. And we're really pleased to say that we're #1 in client choice. 57% of the new Medicaid clients who actually go ahead and choose a plan when they enroll in Medicaid choose Molina. So we're really proud of that. We're also #1 in the Apple Health Quality Report Card. And I don't know if you guys are familiar with that, but only MCO rated 3 stars for getting care and keeping moms healthy. So I'm obviously reading that. I didn't actually know that until Laura put that on the slide. So that's pretty cool. We're proud of that. In Greater Columbia, so the region that we're talking with you guys about today, we have a total of 94,000 members, and our percentage of client choice for Molina is 49%. So that's a little bit about us. Next slide. So the goals of what we'll talk about for the next 15 minutes or so, I kind of went over this, but we'll do a demo showing providers how to get to member rosters on our portal. And then we'll go through some of the processes and procedures that we have here at Molina for assigning members to PCPs. Talk a little bit about how we partner with our providers to try to get those unengaged members, hard to reach members engaged, and also describe our process for ensuring that the PCP panels, member panels, are as accurate as possible. So I'm going to turn it over to Carla, and I don't know, do you guys want me to pause for questions along the way or wait till the end? I'm going to vote for wait till the end. Simply.
Yeah, I was going to say, we can wait till the end. Sorry, I had to be on mute.
That's okay. We're short on time. So Carla, do you want to say hi and go ahead and do the demo or go through the slides?
Sure. Hi, this is Carla Crooks, and I am the External Provider Service Rep for Greater Columbia. And if we can go to slide 4, I'll go ahead and start the demo. Hello?
So you need her to stop sharing and then for you to share?
Actually, no, if you can just go to
The next slide? Okay.
That's what I needed right there. So Molina Healthcare's web portal is accessed through One Health Port. So you would actually want to go ahead and log in through One Health Port, select the Molina logo, and that will take you into our home landing page, which is what you're seeing right here. If you look up to the top right-hand corner, there's a little box. It's a drop-down box, and it'll say other lines of business or Medicare. So for your Medicaid and Marketplace, you'll want to select other lines of business. And then you'll look over to the left-hand side where the blue arrow is, and there's a member tab. You'll want to click on that, and you'll be able to select member roster. So then if we can go to the next slide, this is what it will bring up. And you are able to pull your roster either by all of the PCPs within your group, or you can select just one PCP if you like. So once you've selected all or your single PCP, right below that is what your roster will look like. And in the teal there, that would normally show the member's last name, first name, and date of birth, and their Molina ID number. And then you also have available their line of business and their effective date. And then there's a column called status. And you can also drop down here and sort by the status. One thing that's helpful within this is there's actually new members that you could sort by new members, and you could do outreach to those members to welcome them to your practice, try and get them in to establish care. There's also needed services, and those are, some of the HEDIS services that they're still needing to have performed. And then there's also the PCP name. So this,
Carla,
yes.
This is Carol. I'm sorry, I had to interrupt you. This is so small on my screen. I'm wondering, Demi, if you could go up to the top and create it full scale. And I think the way that we did that this morning, Diane, we went up to the very top of the frame where it has the slide deck showing. Isn't that the way that Risa did it?
Yeah, so it's Demi, it's right up where it says, right
Home.
below where it says recording, and there's like a little projector, like it has like a, so it's up at the very top left side.
Looking right now.
It's right there on your PowerPoint screen.
Yeah.
Right,
Yeah,
right there.
that one. No, that one.
Yeah.
This one.
Yes.
And then
It is very small. I know I was having a hard time reading it myself.
go back and make it so that it's just one slide. And I think you can do it by,
If you
clicking-
go to display settings, and sometimes it might jump to her other screen. So if you go to display settings and then duplicate slideshow, I think.
That's what I'm afraid is going to jump to the other screen. Let me see.
Is that, yep.
No, yeah, use the swap. Use the swap and it'll go to the, yeah. So if
sorry.
you go back to your presentation, yeah, just okay. Go back to your presentation, slideshow, and then just hit swap.
So click there.
It's not doing anything. See?
Click.
Let's see. No, resume slideshow. That's it.
Yeah, click on that. Resume.
And then when I go back here,
Crap, now we messed it all up. All right, just go down to
Yeah, I wish we could have logged right on to the web portal to present this, but HIPAA, there really wasn't a way for us to do that. We don't actually have it.
Okay, that's fine. Just now go down to the slide that you were at, which is like
we were on number 4. Let's see.
Number 4 was the first one, and number 5. So, yep. So this screen right here, I mean, pretty much the member roster is 2 steps. You go into the member section. There's a little drop down for member roster. You click on it. It brings you to this page, which then you can select either all or an individual PCP. And so then where you're seeing the teal over to the left-hand side, that will give you all the member information line by line. And then the line of business. So if you wanted to sort just by Apple Health Adult, you could click on that drop down and you could select just Apple Health Adult. So it's down further, down. There, whoops, way too far down, but that's all right. Then it will give you the PCP effective date, then the status, which is what I was speaking about, where you could drill that data down just to new patients if you wanted to, or just for folks that needed services. Or if you did for all PCPs and wanted to sort it by PCP, you just click at the top and it'll sort by PCP name. This report is also, you can print it from here or you can export it. So if you want to click to the next slide, down at the bottom left-hand side is where you would click on export, and it will let you export into either an Excel or CVS format, or you could print it. So if you want to go to the next slide, this just kind of explains what is actually within the roster. So it has the member name, member number, the date of birth, language, gender, the demographic information, what line of business, the status, PCP name and demographic information, and their enrollment date. And then these rosters are updated daily, Monday through Saturday. And if anybody wants help in getting to these rosters, if you know, I know this was very small and it's very difficult to do it in a slide by slide, I'm more than happy to get on the phone with you and go ahead and walk you through this step by step. it's very nice that you can, download it into that Excel format so that you can sort and manipulate the data however you want. And that concludes my portion. Kelly?
Yeah, hi, thanks, Carla. Okay, so I'm going to go through the remaining key points that we have. The first question that I think this group had was how members are actually assigned to PCPs by Molina. So we have an automated algorithm that runs continually and has many, many components to it, and evaluates new members as well as members on an ongoing basis to determine if they're appropriately assigned. So for the new members, the algorithm takes a look at a few key things. Number one, if the member had been with Molina before and had a prior PCP assignment, it takes that into consideration first and foremost. Of course, it looks at the geographic location, so where the member lives and where PCPs that are potentially appropriate are located. The algorithm also takes a look at if there are any family members for this new member that have been with Molina and have a PCP, and so tries to group the member with the family member's PCP, and several other variables that wouldn't surprise you, such as age, gender, and other particular preferences if the member indicates that. Those are less common, actually. They would apply to things like, a pediatric provider that would take the age of the member into account, obviously. One key thing for us is that if a member proactively chooses a PCP at any time when they enroll with Medicaid or after that time, if they choose the PCP, that overrides the algorithm component. So we always give preference to the member choice. And then if the algorithm runs through all of the components, including there are a few more than what I described here, and nothing really clicks to assign the member, obviously, to a PCP choice, then the member goes into random assignment, and the algorithm looks for PCPs in the general area where the member lives who have open panels and just randomly assigns members to those PCPs with open panels. Next slide. So we also have a process to update the member assignments to the PCP, and actually a big component of that, the primary component, is another automated algorithm that is different from the first one. So that algorithm takes a look at claims, and to the extent possible, also takes the member's geographic location into account, i.e. if they moved, the algorithm would try to assign them to somebody closer to them. I'm saying trying because it is an automated algorithm, and members' a location, their address, needs to be kept up to date with us by the member, and so that doesn't always happen. So this algorithm, we call it the reassignment algorithm, takes a look at geographic location to try to ensure, of course, that the member is assigned to a PCP in their area. And then the algorithm takes a look at claims. What it's looking for is whether or not the member saw a different PCP other than the one they're assigned to more than 2 times over the past 6 months is what the algorithm looks for. And that if that member did not see their assigned PCP and did see a different PCP twice, then the algorithm will reassign the member to the new PCP. That's the criteria that Molina uses to determine if a member is, engaged with a new PCP. We did put a note at the bottom that an algorithm is just an algorithm, and it's, it's not perfect. So there are members that aren't caught sometimes by either of these algorithms. Most are, but some aren't. The other key thing here is that, and I'm sure you're all familiar with this, the underlying data that the algorithm runs off of needs to be correct and kept up to date which is always a problem when or a challenge when you're dealing with complex systems related to Medicaid members' information in our systems. So next slide, please. So we have a process at Molina that we built, I think it's been about 4 years ago, called impanelment. No surprise about that. And it's a process to try as much as possible to keep the providers who have a value-based care contract with Molina, to keep their member roster as up to date as possible. So in addition to all of the processes that I just described to you, for our providers that do have VBC agreements, we also go through their member rosters. We shoot for at least once a year, and we're looking for any members who may be incorrectly assigned, i.e. the algorithm, the reassignment algorithm, or the assignment algorithm did not actually catch that the member should be assigned to XYZ PCPs. So for whatever reason, there could be a number of reasons. So we look for those members who, they live far away from the PCP they're assigned to, or they meet that criteria, they're seeing a different PCP than the one they're assigned to at least twice. And we get a list of those folks, we send it back to the provider and say, hey, we identified these folks who are eligible to be moved. Do you want us to reassign them to new PCPs? And the groups get back to us and indicate, yes or no for all of the members, and then we reassign them. So we have that process running on a continual basis. We have a large number of our primary care providers on VBC contracts in Washington. In fact, I think 85% of our Medicaid members now are impaneled with providers who do have these value-based care contracts. So it's a really, really large piece of work, and will continue to be up until the time where automated algorithms and or data in our system is absolutely perfect, which is a really, really high bar. So that is our impanelment process. I think there's another slide. If there is, next slide, please. Oh, right. The question about visits to assigned or unassigned providers. So as you guys know, we are required and committed to ensuring that every Medicaid member has an assigned PCP. However, we don't require that these Medicaid members actually see their assigned PCP in order for the member to get in, that a provider to get paid. We do put the name of the assigned PCP on the member's card, and they get a letter saying, you are assigned to this PCP. However, if the member chooses to go to a different provider at the practice where the PCP practices, or a different practice, we allow that. We really, really strongly believe that we just want to ensure these members have good access to care, and as everybody else does. And so one way that we do this is to allow them to see any PCP, and that PCP will get paid. There are a number of sort of cleanup kinds of things we have on the back end for our capitated providers and our value-based care providers to ensure that all of the visits and the reimbursement for those visits are kind of cleaned up as far as the financial aspects of that go. But we do that. We do encourage our members to see their assigned PCP. But again, we don't require that in order for them to go to a PCP that's contracted with us. Next slide, if there is one. Oh, yes, it's a good one. So we do help members change their PCPs, and this, I'm not going to read through the slide, but this lists some of those ways. The members, of course, can change their PCP at any time. They can go to the Molina portal. We have an app, a mobile app they can use. if they happen to have access to a fax machine, which is rare unless they're in the provider's office, the provider can help them with this. They could fax or they could call member services. And providers certainly can, help a member change PCPs by faxing in a PCP change request form that's it's available through this link if anybody's interested and wants to get to it. We do aim for a turnaround time of 7 days, and the contact center tries to keep up with that. And then any changes that come in are effective the first of the following month. And then the member will receive a new ID card, within about 7 to 10 days to indicate that change has been processed. I'm pretty sure that's the last one. Oh, contact information. Our 2 reps in your region. Carla, you've met. Martha Jorgensen is the other rep. They're both super. They're both on my team, and I can't say enough good things about them. So here's their contact information if you guys need help with any of this. And I think that's it.
Thank you. Thank you, Carla and Kelly. Does anybody have any questions for either one of them? Sarah, we will also have access for these slides so that the contact information is on the slide. So we will, you will be able to have access to these slides for that.
All right, thanks guys.
Okay. So the next one up, could you pull up the agenda, Demia, or announce the next person?
The next person would be, presenters would be Community Health Plan.
All right.
And it's on the screen. Can you see it okay?
No, we can't see it yet. And I believe Ron Taylor is going to be presenting for Community Health Plan of Washington.
Yes, I am. Can y'all hear me well?
Yep.
Okay, very good. I am the eligibility analyst as opposed to someone with provider relations. So I'll be running you through more along the lines of the mechanics behind how we assign members to our rosters and the process to go about making changes to those rosters. Next slide. As we're all aware, the first initial assignment goes to the MCOs via the Healthcare Authority if the member hasn't already selected an MCO to utilize. The Healthcare Authority has their own round robin algorithm that they use in order to assign members to a specific MCO based on contracts and availability of providers. Next slide. We receive, as does all of the MCOs, a daily update from the Healthcare Authority via Provider One, and download those each day, and that is audited each month by a month-end audit file, which we're gearing up to process for the month of June this weekend. Okay, next slide. Once those member records are have reached us, we utilize geocoding in order to locate the member exactly where they live, and we also geocode the providers, the provider networks as well, and then we use that in order to assign members to the nearest possible provider, contracted PCP. Next slide. And we use a round robin type of process where we'll gather a group of members together in a geographic area and then round robin, just basically pull them all off into the different clinics, and we assign at the clinic basis. And so the more contracted PCPs that are within a clinic, the more clinic assignment they'll get. And we strive to keep families together. There's part of that assignment algorithm looks at that as well as the location. Next slide. So we talk about timing, and if a member is signed up and fills out the application for Medicaid on, like, say, yesterday, we'll get that today. We'll get that file overnight, and we'll put them in our system today. And then at the end of business today, after everything is completed and the members are assigned a PCP, then the downstream vendors will also receive that eligibility update. That includes pharmacy, care organizations, and we'll send out an extract to our ID card vendor and basically go from there. Next slide. Okay, and once the members are uploaded and the algorithm goes through and assigns them a PCP based on their location, we'll go through and check to see if they've given the through the 834 file any indication on the provider they want to see, and we'll make those adjustments on that same day before any of the eligibility information leaves our house. As anyone that's had any contact or any exposure to an 834 file knows that the actual number of members that actually give us a preference is very, very low on that particular file. Most of the members that we receive from the Healthcare Authority are auto-assigned. I applaud Kelly for her tact in which she talks about the Medicaid population in general, but we are very cognizant of that and do whatever we can in order to assure members' preference if they've given us one. Once that is completed, there are a bunch of different reports that we utilize in order to assure that the member is appropriately assigned. One has to do, like I mentioned before, with other family members. And then we also take a look at the age, just to make sure that we're not assigning, a 30-year-old to a pediatrician and things like that. Okay, next slide. If a provider or a member presents themselves for care at a clinic to which they're not assigned, the clinics all have these clinic change forms that they're given and made available to in order to change that PCP. The change is usually applied at the first of the following month. If the clinic has indicated that the member has not seen any other physician within that month, we may be able to retroactively assign it back to the first of the current month. We strive to have a 1 business day turnaround time on those change forms coming in. They're submitted via email, usually fax sometimes for some of the clinics. And like I said before, they're generally used to change clinic assignment from one clinic to another. We don't, while I see a chat message, a chat question there. How many Medicaid clients does CHPW have? We currently have right around 200,000 members, Medicaid members assigned to CHPW. Unlike Molina, we're not statewide. We've got the Salish region that we're going into in July. Other than that, I don't know what to tell you. Oh, this PCP change, the clinic change form, is also a way for us to be alerted to newborns and the clinic assignment for a newborn, should it be different than that of the mother. When newborns are created in our system from claims, they're assigned automatically to the same PCP or the same clinic where the mother is being seen. If the mother wishes to change that, she can contact us and let us know. Okay, next slide. We too have value-based contracts, care contracts with provider groups, and as a way for them to evaluate and correct their own rosters, they can send to us members with whom they've been able to contact and communicate back to CHPW who that member would like to see. Once we have that, we can make that PCP assignment, you know, given that that assignment is communicated, the provider mentioned in this communication is a contracted PCP. And we see a lot of those, and I think anybody that's in this business knows that members can move around quite a bit. Some of them move quite a distance, and can move across regions even. So we have algorithms in place to reassign members to a new PCP in their area if they've moved out of that area. We have a program that looks for a change of address greater than 25 miles, and then the member will be reassigned based on the original algorithm. Go ahead to the next slide. Like I said before, unlike other MCOs, we are assigned at a clinic level. All of our communications to the member, all of our phone calls, it's all communicated at the clinic assignment level. And even though it says on this slide that claims are paid at the clinic level, I think it's going to be at the IPA level, meaning that if a member that's assigned to a CMAR clinic in one town sees another CMAR provider in yet another clinic in another town, that claim will still pay. We have many different ways. Well, I'm not going to say many. The main way we communicate our assignment is through the rosters and through health maps. And I wish I had included slides to show the health maps portal, but it's actually quite good. If providers don't have access to health maps, they can gain access by emailing CHPW. I'm going to give you actually the name of an individual, Brian Berry. Brian.Berry is his actual email address at chpw.org. They can get you set up if the clinic isn't set up to receive those rosters. The rosters are at the IPA level, meaning, you know, each organization, each chain of clinics has their own roster, and within that roster, the members' information is relayed with regards to the line of business. I'm going to bring this up here real quick so that I have it in front of me. The clinic, date of birth, address, language, and we also include whether or not the member is a new member, if they're set to term at the end of the month, and if the member is showing an indicator from the healthcare authority that they're pregnant or expecting. We also include other health insurance within this file as well, which is also available on health maps, including the carrier name, the effective date, COB order, the coverage type, and the policy number if it's available. One of the things that I wanted to note on here, and one of my areas of responsibility that's kind of a pain in my side, has to do with COB information, and that we try to communicate all the time that while COB information is available on Provider One for each of the members that have been reported with COB, the MCOs are actually the people that verify this OHI information and report back to the state. So instead of Provider One being the source of truth for OHI, it's actually the MCOs that are actually the source of truth. Whilst the Provider One and the Healthcare Authority assigns members to the MCOs, and Provider One is the source of truth for that information, you know, please refer to the MCOs information systems for the OHI information. And I have down below also a sample ID card that shows all of the pertinent information needed for the members. And on the back of the card, while it doesn't show it, it also has all of the relevant phone numbers, including urgent care numbers and nurse advice lines and things like that. Any questions?
There was one in the chat that said, what is the benefit of assigning to a clinic versus to a single PCP?
That is a really good question. I'll give you the best answer that I can. A lot of the clinic chains, especially in the community clinic organizations, have floating PCPs, PCPs that are contracted to practice at not only one clinic, but a number of clinics. And a lot of the clinics, and this goes for affiliates as well as member centers, have, I'm not going to say they have a lot of turnover. And so the clinics are not always very astute in being able to communicate a termed provider to us. And so as a result, we end up with members in our system that are assigned to a PCP that is no longer practicing. And so if we communicate the clinic assignment as opposed to an individual PCP assignment, there are fewer notifications to go out and fewer confusion on the points on the part of the member. Because imagine you're assigned to Dr. Jones at Health Point Auburn, and Dr. Jones quit there, and 3 years ago, and we never knew about it. And if, for example, the member receives a letter that Dr. Jones is no longer at the clinic, the member will look at this letter and say, who is Dr. Jones? I've never seen Dr. Jones. I don't know who Dr. Jones is. And it turns out that the auto assignment assigned him to Dr. Jones, where the member did not give us any preference or didn't call in to tell us any different. So it's all a matter of avoiding confusion and making it more simple and less restrictive as far as resources are concerned when a PCP changes clinics, practicing locations, or quits altogether. I hope that answers your question.
Great. Does anybody else have any questions for Vaughn?
I do. Vaughn, this is Carol Moser again. Could you again talk about how to find out who is on your roster? You said you don't use One Health Port, you use another platform.
Well, Health Maps is available through One Health Port.
Okay.
And you can access it that way. Yeah. And what it'll do, it'll log you into our Health Ports, our Health Maps system. And the provider portal is really robust, and it'll show the members here. Let's see. It'll show the members, the member rosters for the providers, and it'll not only show the member rosters, but it'll give you 2 types of member rosters. One member roster is a static member roster that we do on the 2nd business day of every month, and that'll remain the same and listed for the providers in there. The second roster is formatted exactly like the monthly roster, but it's labeled as the daily roster, and we refresh this on a daily basis. As you know, the Healthcare Authority will retroactively assign members to the plan. We have to assign them to PCP, to clinics, and then the clinic organizations need to know, well, who has been retroactively assigned to my clinic? And it's this way that we'll go in and we'll refresh this one every day so that you can find out who's new and who's been removed. The first one is static because we find that organizations like to use that first one to reconcile against FQHC payments and capitation. And those 2 reports are also available on Health Maps.
All right. So the source is One Health Port, and then it sounds like Molina and CHPW have different sites that you go to get the rosters. Is that right, within One Health Port?
Yeah, I believe that's how One Health Report works. It's a one login type of a situation where you just need the one login in order to access all the different organizations, the MCOs.
Okay, that's very helpful. At one point I had remembered hearing that there was one MCO that was sending rosters monthly to provider organizations, but that may have changed. I think that was something we heard maybe a year or two ago. So it sounds like
Well,
One
we
Health
used to
Report
do
is.
it monthly too,
Oh,
years ago.
okay, all right.
But as soon as the Healthcare Authority started updating members retroactively, I think that was April 2016, if I remember right. As soon as they went to that type of a system where members are updated retroactively, we felt the need to give the clinics a way to verify daily via the roster if a member is new. And of course, our provider relations folks encourage and strongly that providers check health maps the day prior just to assure that the members that they're seeing on the following day are actually still assigned to them as well. So
Thank
makes
you very
sense?
much.
Does that
Yes,
answer your question, Carol?
it does. Thank you so much.
You bet.
Diane, I don't know if you're talking, but there's, I think it's a break, huh?
Sorry, yeah, it was
Yes.
like all of a sudden it disappeared on me.
It's like, wait, we
Okay,
have a break
so
here.
we're going to take a break here. Does anybody else have any more questions? I didn't see any in the chat. So we'll go ahead and take a break, and we will be back at 3 o'clock. So we'll take a break, get some water, stand up, do some jumping jacks. Okay. All right. We did have one question in the chat that came in that said, for patients that are assigned providers and not a healthcare facility or team, is there a way they can pull the roster for the facility and not just the individual provider? And I think that was geared towards Vaughn, because I think with Molina, they did show us how you can do it with the other providers.
Yes, the rosters are generated at the IPA level, at the organization level, but the clinic is listed as one of the columns, and so they could certainly download the roster and sort by column in order to drill down to that specific clinic location.
Perfect. Sam, did that answer your question?
Yes, thank you.
Perfect. Awesome. Okay, so we're just going to move right along. And so we are going to go with the Mara Group, and Micah Rockefeller is going to be the presenter for that.
Hello, can everybody hear me okay?
Yep.
Okay, thank you. So the information that I'm going to provide you today is probably very similar to what we've heard from the other MCOs. I am one of the provider experience managers here at AmeriGroup, and I do work in the Greater Columbia region. So this first portion that I'm going to show you is going to be a little bit different from the other MCOs because we do use Availity to be able to access our information for our web portal. So the first thing is that we do need to make sure that the providers are all registered to be able to log into Availity. And once you get into Availity, it's going to take you to the main page. This particular screenshot, yours might look different, but we do want you to navigate into the AmeriGroup Real Solutions page so that you can get into provider online reporting once you've logged into Availity. And then if we scroll down to the next portion down here, it'll take us to the next page. Thank you. So this is where, again, it's going to be slightly different from some of the other organizations. Once you have registered your organization, then what you can do in Availity is you can select your organization name in the drop down. And if you don't mind scrolling just a little bit further on on the screen here, so you can see the drop down on select an organization. And so that's where you'll go ahead and select your group's name here. And then once you hit submit, we can keep scrolling and it'll go to the next screen here. So I highlighted a little bit of information because this is a little different. So from the report search screen, we want to make sure that you are looking at the one that says member panel listing. The difference between the member panel listing and the member reports is going to be based on what type of agreement you have with AmeriGroup. So there are going to be some provider groups that have value-based agreements and things like that. For the purposes of a primary care provider, just being able to look and see who is on their panel, we would go ahead and look at the member panel listing. And so we can keep scrolling down here. So once you click from the drop-down menu, then you can choose the program that you'd like to work, or you can select the member panel listing. So for most of our providers, again, we're going to go ahead and just select the member panel listing. So we can keep going there. And then on this section, what we're going to have the providers do is select the tax identification number. This is going to be, again, different based on your agreement and how you are set up within the AmeriGroup system. Once you get to this portion and you select your tax identification number, you can download the entire listing for the tax identification number. Or you do also have the option to select an individual or a group provider. Most of our providers are going to be looking at downloading that listing for the entire TIN, and then what they would be doing is going ahead and working the report from what they've downloaded. So you're able to go ahead and export that report. And then if we go down to the next one here. So this is where there's a couple of other options that our providers have depending on the contract that you've got with AmeriGroup. So once we get in here and we have the member reports that are available, if we scroll down just a little bit further into that search criteria, there are a lot of different items that are available based on the agreement. So this is the opportunity for a provider to get in and get some more specific data that they're looking for. So not just the panel assignment. And then we can keep scrolling down to the next page here. So on this particular item, this is the Medicaid, we call it PQIP, but it is the Provider Care Management Solutions portal, and it's actually going to take you into a different reporting space within AmeriGroup, and this is going to be specifically for those providers that are enrolled in this particular value-based agreement. So again, this particular report is only going to be if that is how you are contracted with AmeriGroup. And again, it's going to take you into a completely different section of the website. Like some of the other MCOs have indicated, I am available to our providers to be able to do screen sharing and walk them through Availity. A couple of other things to note about Availity. Out on our AmeriGroup website, we do actually have a section of our website that is specific to trainings, and it has a listing of the trainings for Availity. They are different. Each training is different. So you do actually also get the opportunity to take some trainings directly from the Availity folks. But myself and the other provider experience consultants and managers on the team, we're all available to be able to walk folks through this. I'll just echo some of the things that the other MCOs have stated as well. We also have an app that's available for our members so that they can do primary care provider changes. We do also have the ability for members to log into their own portal. So similar to the provider portal, the member can log in and make those updates there as well. And then we do also have a provider PCP change update form that is available out on our provider facing website. So that's also an option. And then if there are, like I said, any additional questions, we are available to answer those. And if anybody does need my contact information, I can go ahead and provide that in the chat box as well. So thank you.
Thank you, Micah. Does anybody have any questions for her before we move on to the next presentation? Okay. Thank you very much. If you could put your information in the chat box, that would be helpful.
Yes, not a problem. Thank you.
Great. All right. So for our last presentation, we are going to have coordinated care, and Suzanne Townhill is going to be one of the presentations and presenters, and she can introduce her team.
Actually, Suzanne Towell, and I won't be presenting first. So I'm going to hand it over to Elizabeth, who is first up with regards to the member panel reports.
Great.
Elizabeth, you might be on mute.
Elizabeth.
I'm working on it.
Okay.
For some reason.
Do I need to stop sharing, or do you want me to share?
No, I think, can you see me? Hi.
Yes.
Yep. We can see you now.
Okay. Hi. Elizabeth Aubert. I'm the provider network specialist for coordinated care. And my region is actually Pierce County, Mason County, and Thurston County. But I am one of the primary people who do the training for the portal. So I was asked to do this, be part of this. So I thank you for having me. And so I'm just going to jump into my portion of the presentation, and then Suzanne will finish up with the PCP change aspect of it.
Perfect.
Thank you. So next slide. So from our website, from our coordinatedcarehealth.com website, you could access the patient roster through two different directions. One would be from the dashboard through the patient analytics section, and the other would be from the patient screen on the from the eligibility section. So the slide shows where you would click on it. So we're from the patient analytics section, which is just right on the dashboard. And then once you look on the dashboard, if you click on patients, then you could create your patient roster from there. So next slide, please. So the first, I'm going to walk you through both types of, through both directions. So from the patient analytics screen, you would click on the patient analytics, and then you would want to immediately export it so that you could have it on an Excel spreadsheet, and you could adjust your columns to match whatever you would need as far as the different information that it contains. So on the next slide, it has a list of all the column headers so that you would be able to identify what would be most important for you, and that you would be able to glean patients who need to be corrected off of your roster, or identify patients that need to be added to your roster. Like you see them, but they're not assigned to a PCP. So next slide, so we can look at the different headers. So when you export it, these would be the header information that you would have on the Excel spreadsheet when you pull a roster based on the patient analytics screen. So a lot of this information is also helpful when you have, because it helps you to identify where there's care gaps when you have, when you're working with the value-based agreement too. So, but it has member name, the member ID number, address, their gender, date of birth, phone number, high priority care opportunities, risk scores, inpatient scores, and if they've had recent inpatient stays or ER visits, and what physician groups they're assigned to. Subgroups would be whether it's a pediatrician or a specialist or primary care. Next slide, please. Thank you. And this is what it looks like. The top of the spreadsheet looks like when you pull it from the patient screen. So at this point, you would select the patient list and then download it and export it to an Excel spreadsheet. And this is a more comprehensive roster, because the other one would have mostly the members who are involved with who have care gaps and stuff, so that you could glean out the information that you need for capturing things, the different matrix. This has all of your patients and all of their information. So this is what it would look like when you export it. And next slide, we'll go over all of this. These are all the different categories. So as you can see, it's a lot more comprehensive. It identifies members who are in our locked-in program. So they are assigned to a PCP. They have to have a referral from PCP. For all of their services, they're assigned a hospital and a pharmacy. It has the information about preferred languages and whether they're part of our case management program. So it's a lot more comprehensive. And it also includes care gaps and information about the assigned PCP. And next slide, please. And so this is some provider resources that we have. And then the provider network specialist assigned to Greater Columbia region is Lilia, and I've included her contact information. So, and then Suzanne will present next. Thank you.
Before I start, did anybody have any questions for Elizabeth on the rosters? Okay, I'll go ahead and get started then. So I'm going to cover Suzanne Towell. I am the Senior Director of Member and Provider Solutions here at Coordinated Care. And if we could go to the next slide, I'll just go ahead and get started. So we can do either auto assignment or manual assignment, as just like the other carriers. There's multiple ways that members can change. So each one has the ability to make their own selection, and then we use a logical algorithm to automatically assign for members who have not selected their own. Some things to keep in mind is that the PCP is considered protected health information, so we must have the member or their authorized representative approve a change if it's made. Sometimes we'll get requests from providers saying, hey, can you move this person off my panel? We actually have to reach out to that person and have them select a new PCP. We don't just randomly put them on somebody else. So to kind of let you know how that works. And so we usually get, just like the others, the fax request, sometimes a spreadsheet that has some level of documentation of the member's signature approval to make the change when those come through from a provider. Next slide. So what's the difference here? I'll talk about manual request first. So multiple venues, similar to the other carriers here, they can submit a request on their secure online member portal. They can complete a form that they get in their welcome packet, or they can complete the form at the provider's office that the provider will fax in, or they can just call into member services as well. So keep in mind, if the panel is closed to new enrollment, our customer service department, whether they're processing when these are coming in from any of these medium, they're going to reach out to the provider that's been selected to ask if they will accept this member on their panel or not. Unless, of course, it came from the provider themselves. I should clarify that. If you faxed it into us, we're going to assume you're accepting the patient. If the provider is not accepting the member onto their panel, then we will reach back out to that member to assist them in finding another PCP. For auto assignment, we do a weekly sweep of our membership to identify any members without a PCP assigned. And the algorithm goes through looking at some of the similar things you're looking at: member demographics, the location of the PCP, the panel requirements of the PCP. Things that I missed on here that I made note of earlier is it also checks to see, has this member been with a provider before? and is that provider still active and available and in their geographical area, then it'll reassign that PCP. It'll also look to see, are there any family members that I can identify that have a provider that can be linked as well. We do not put the PCP name on the member ID card at coordinated care. So what we do is when a provider change occurs, we send a letter to the member to let them know who their new provider is, that we've processed that change. If the member does happen to order a new ID card, we do also put the current PCP and phone number on the ID card holder. So they do get that information with it, but it's not on the card itself. Next slide, please. So processing times that have come in. So when they're coming in through the web portal or through the telephone, those are processed live at the time that they're happening. PCP request forms that are faxed in, those are worked by member services upon receipt or up to 3 days if volumes are high. There's been some times in our past where we've gotten a backlog, but we've worked through those. So generally it's up to 3 days at this point. Member PCP letters are sent weekly for the previous 7 days of activity. All right, so I was asked to also talk about if we've had any issue resolution. One of the trends that we've heard from providers and from members, not everybody, but some, where they're saying, hey, I've made a request and it's not sticking. It's just, I have to send it over and over and over. And so we did a little more digging into that and found the root cause to be submission errors with the initial request, where it was seeing the panel as being closed, and so it was airing out when it should have been over, either submitted in a different way so that it didn't hit that error if it came from the provider, or was worked differently by the member services rep who worked it. And so starting in April, so for the past 4 weeks, we have been working a daily report to identify those. And I'm happy to report, hot off the presses, that that error rate of those initial requests going through dropped from what was a systemic issue at 50% down to 12% in those 4 weeks. And we're continuing to work to drive that down even smaller. That 12% that's happening are the ones that we do the next day and rework it. And so through staff training and through research to see if there's a setup issue or if there's some other kind of issue at the member level or at the provider level, we're working through those as we get them on a daily basis. So I'll put out there for you, if you're seeing that kind of an issue occur, please let Lilia know if that continues for your practice. Next slide. So that leads into the monitoring of, once PCP is assigned, how do you know that it's still appropriate? And so if we have provider terminations, providers leave one group, go to another, those panels are reviewed for any current members, and then they are moved to another PCP using the auto assignment algorithm generally to map them, unless it's been identified through the termination process. It might be where it is a group change or something like that. That's not a true termination, in which those members are mapped from the old setup to the new setup of the same provider who's still going to be there. So some of that occurs at that time. Another piece that is happening should be coming through Lilia and with some other, that is just an increased level of engagement with PCPs on their paneled members. So we're working on rolling out a process of looking with the provider offices, assessing which members are engaging with you, so we can compare claim data to the assignment to see these members, especially for value-based contracts, these members are engaging with you. These members are actively engaging with another PCP. And so we're working on how do we now get those two onto the panel of the PCP that they're engaged with.
We're having technical difficulties here.
Eric, I was gonna say we lost the
Sorry
audio.
about that. My phone just disconnected. It's usually my best way. Can you hear me okay?
Yes.
Yes.
And
I
I'm
went
going
to
to
the
need
next slide
turn
too.
you
Is
up
that
because I
okay?
can't hear you. There we go. Sorry about that. So I don't know where I cut off, but it's going to be with looking at how we can get where members are engaging with their providers, get them onto those providers panels, especially for those providers that are on value-based contracts, so that they get their engaged, the patients they're seeing are on their panel appropriately. So there's a whole process with monitoring and making sure that's happening going forward. So here's some resources for members. All the links are in here on our PCP form on our website, English and Spanish, the link to the portal login, what to either register or to log in, and of course the phone numbers for both member services for Medicaid and Apple Health for Connections, which is the foster care program for the statewide integrated foster care program. And then the next slide is provider resources. So similar to the previous one that Elizabeth had, there is an online link to a list of our provider resources that are there, as well as the provider portal registration and login. The provider services phone numbers are the same. You just select provider services instead of member. And then Lilia Cruz is the provider network specialist for the Greater Columbia region. And any questions?
Thank you for presenting for us. I don't see any questions in the chat box. Did the navigators want to do the navigators have any comments that they wanted to say?
This is Brittany. I greatly appreciate you guys going over this. It actually answered a lot of the questions that I had. So thank you. I thought that was very well presented, and all of the questions I submitted before the meeting, I feel were answered. So thank you for that.
Great. Thank you, Brittany.
I didn't have any additional questions. This is Laurel. Thank you so much for presenting. I think it's really valuable information. Thank you so much.
Sam, did you have any closing comments?
No, I'm just greatly appreciative, and the information is valuable. I think that our providers and our navigators actually have been doing the correct training in order for us to be able to align those metrics, and hopefully help assist these MCOs to be able to fulfill their metrics as well, or I guess their demands of the healthcare authority. So anything that we can do that we can not duplicate efforts and then make it easier for the MCOs to be able to communicate with our providers, and also for that bi-directional communication. Definitely we want to be on the same page. So I appreciate all the information. It was wonderful.
All right. Well, if we don't have any other, yes, Carol.
I just wanted to say something that I do really appreciate having the managed care organization take us through MCO rostering. It is one of our milestones. It's really important to us that our providers are knowing and understanding who their patients are. And I can see how it would be very confusing as a provider organization, because the processes are, different between managed care organizations. So this has been, super helpful for me to understand some of the complexity. But I do think that it's really important that the MCOs realize that we incent our providers to look at those rosters and impanel their patients. And I did hear some comments even about value-based payment contracting. And so that's one thing I want to make a pitch for, is that I think we are one of the only ACHs that really does feel that that it's really, really important to support our primary care providers and our behavioral health providers. All of the providers that are under contract with Greater Columbia ACH get a lot of technical assistance from our navigators. And so we are really looking forward to having those value-based payment contracts coming into our region. We happen to be one of the regions that have the lowest rate of VBP adoption, and yet I think we're trying really hard to get our providers to that patient-centered medical home model certification so that they can take advantage of value-based payment contracting. So you can see from this presentation and our attention to detail and how we want our providers to succeed, that we're very serious about getting our providers into those VBP contracts so that they can do a little bit more for all of their patients. So thank you very, very much. I just wanted to make that pitch and to thank the MCO representatives for presenting today.
Does anybody have any other comments before we close for today? Thank you, Carol, for that closing statement. That pretty much sums up what how we feel at GCACH, and we do appreciate your guys' time today. So oh yeah, we have one more poll, and the question is, and Damia's going to put it up for us.
Can everyone see that?
No.
Oh wait, hold on
I
one
don't see
second.
it yet. Okay. So if you could just answer this last question for us. And the question is, hopefully, was this information useful? So answer this, and then hopefully we just want to make sure we're providing with information that is useful. And so we just wanted to, poll the group on that. All right. Damia, I think you can go ahead and close it now. And if you wanted to display it, you can. Perfect. Great. Thank you guys so much for being here today. We really appreciate it.
Thank you, everyone.
Bye, thank you.
You.
Thank you.